Right. I got interested into health issues possibly because of an accident that happened in my personal life. As a child who was growing up in a small town in Bihar, I must have been about 9 or 10 years when I saw the first case of suicide in my life. We had a neighbor whose wife committed suicide. She basically immolated herself. And it was a major incident in an otherwise calm, very settled, years of childhood, and that the question about why would someone commit suicide has stayed with me. And years later, when I had an opportunity to do PhD, I thought about it, and I thought, why not take up that question and see what are the causes, what are the reasons for people to choose this kind of death. So that's how I got into suicides, and I eventually wrote my PhD on suicides. I have been interested in some sense, in rural India. I have been interested in peasantry, in farming. I have been interested in inequality within farming. I have also been interested in the question of gender and farming. So basically, the questions of how farmers are not only an occupational group, but farmers are also gendered social beings. Farmers are men, farmers are women, farmers are social beings. So different social identities are also associated with this occupational group. Questions of caste are important, questions of reason is important. So in some sense, I have been interested in farming and culture, farming and political economy, and farming and health as an overlapping field of research work. Right. The couple of preliminary observations one could make about it. The first one is that when I think of health, I think of health in a very broad sense, and the term that comes to my mind thinking about health is this idea of wellness or well-beingness. And when one thinks of health in terms of well-beingness, then one is also opening up oneself to understanding different dimensions of well-beingness. So there could be a social dimension to well-beingness, there could be a political dimension to well-beingness, there could be an economic dimension of well-beingness, and of course these are all analytical distinctions that we are making. They all overlap, they all intermingle with each other to generate this feeling of being feeling good, feeling well, or not feeling well. So I think I would understand health in a broad, comprehensive way, and I would also think that the question of health is not only about, it is certainly about infrastructures of health and services of health, but it's also about ideas that people have about well-being and health, both of them. My sense is that there is evidence, but then probably the evidence is not being brought together to generate a multi-dimensional view of health. It remains, as we often say, it remains tied to silos that of disciplines, silos of ways of understanding reality, and hence the evidence need to be brought together to broaden our understanding of health and issues of health. And to that extent, I think there is a lot of scope for bringing together different perspectives to illuminate questions of well-being and health. I think that may not have happened. It needs to be made more comprehensive than it has been so far. First of all, I would say that there could be different levels at which we can think of health, and then there are different dimensions of thinking about health. These are two different axes that one can go to. So, for example, within social determinants, one could then think of different levels of social determinants. So, for example, one could think about community level social determinants, very local community level social determinants. Then one could scale it up to talk about maybe mandal or district level, and then probably go further up. That's one way. And at the same time that one is doing this, one also needs to be aware that there are different dimensions at each of these levels. So social is one part of reality. There could be economic as well, there could be political as well, and the task in some sense is to integrate the vertical levels of understanding within a dimension, levels of understanding issues of health, and at the same time linking it with the other dimensions at that level as well. So I would say that that is a major challenge. I would talk about two important things that one could probably bear in mind when one is working or is a student of public health. The first is public, the idea of health as a public issue. Disciplines like sociology and anthropology think of public in the sense of something that is not individual oriented, something that is general, something that is at the level of collective. So to that extent, I think one has to always probably be aware that public speaks to the collective of it, something that cuts across individuals. That's one. Second is, I think that one might also be a little more aware of how people, communities think of wellness. It's also respecting that we as professionals may have a point of view, but then the people who we are studying or who we think are in need of public health, they might also have their own perspective, and we need to understand it. We need to integrate it with our professional understanding of public health as well. So these are two things I would say one could probably remember.